With diabetes, it's all about a number. Right around 100 is a nearly perfect blood sugar count. But for people with diabetes, that number is constantly moving up or down, hundreds of points higher, or it might fall dangerously low. Type 1 diabetics require insulin to keep blood sugar from rising too high. Then there are the more common type 2s, like Brenda Toms of Kingston.
And I've really done something about my weight. I've lost almost 17 pounds.
Type 2 diabetics like Mrs. Toms control diabetes through oral medications, diet, and exercise. For them, losing weight is a great way to get better control of blood sugar. But living with the disease is a daily challenge.
I'm real bad about carbohydrates, especially pasta. I'm Italian, so that's my hardest problem. But taking this class really helped.
The class is Taking Charge of Your Diabetes, taught by UT Extension across Tennessee. Here's a recent session in Roane County, led by Agent Justin Thomas, who talked about teaming with your doctor to develop a smart healthcare plan. 12% of Tennesseans have either type 1 or 2, giving us one of the highest rates of diabetes in the nation.
You can look at lifestyle, tradition. A lot of people in rural settings, they don't want to ask for help because they're very prideful in what they do. They've always managed to get by and do things themselves.
I'm one of those Tennesseans with diabetes, type 1 for more than half my 50 years. I know firsthand the physical demands of diabetes, but it can also take a tremendous emotional toll.
We look at positive thinking as a way of getting through the day, learning how to correct those self-defeating thoughts.
Mostly diabetes requires self-care. You can't call your doctor a half dozen times a day to relay a bad blood sugar. Some things you must handle on your own.
Self-management is the key with our diabetes education classes. It's a day-to-day thing that people with diabetes have to know how to eat properly, how to balance that with their physical activity and with the insulin that their doctor has them taking.
For now, there's no cure for diabetes, but with efforts like this, we can give people the knowledge and encouragement to manage their disease and keep posting those good numbers. This is Chuck Denny reporting.